Let's see the screen test we do during the third trimester of pregnancy. So, in the third trimester of pregnancy, at 27 weeks gestation, we are going to repeat a complete blood cell count. This is to evaluate for anemia. Remember that in the first trimester, during the initial visit, we ordered a complete blood cell count to evaluate for anemia besides other stuff, but it could have been the case that the patient during the initial visit does not have anemia, but now that the pregnancy is more advanced and the baby is growing, the demand of iron is increasing, and so the patient could have anemia of iron deficiency. So especially if the patient is not taking iron supplementation. So at 27-week gestation, we order complete blood cell count again to reevaluate for anemia, and if hemoglobin is less than 10, normal range during pregnancy is 10 to 12. If hemoglobin is less than 10, then this is diagnosis of anemia, and without any other test, we are going to treat the patient with iron tablets. This is because by far the most common cause of anemia during pregnancy is iron deficiency anemia. So we are just going to treat the anemia with iron tablets, and if this does not correct, then we are going to do a full workup for anemia. Then during 24 to 28 weeks gestation, we do the universal screen for gestational diabetes, which we reviewed in the previous video. And at 36 weeks gestation, we order for chlamydia and Neisseria test, and group B strep culture, rectovaginal culture. And if the patient was positive for some sexual transmitted disease, we are going to reevaluate for that, or if it is a patient with high risk. So during the third trimester, we reevaluate for anemia with complete blood cell count during 27-week gestation. 24 to 28-week gestation is the universal screen test, but remember that if this is positive, then in the postpartum state, we need to reevaluate for diabetes mellitus during the postpartum, and if that is abnormal, then she is diagnosed with diabetes mellitus. But if it is normal, then if it's normal, the postpartum test, then we are going to do a glucose test 1 to 3 years, screen glucose test. And if the patient is going to become pregnant, then this is a patient with high risk of having gestational diabetes again. So this patient should be evaluated for gestational diabetes, not during the third trimester as it is usually done, but in this case during the first trimester, as we saw in the previous video. That is in the case that the postpartum screening was normal after a diagnosis of gestational diabetes. Then at 36 gestation, we take culture for group B streptococci and also chlamydia, Neisseria tests, and if it is the case of a high-risk patient, or if it was positive for sexual transmitted disease, we do that again.